Lasik consultation entails an extensive and an in-depth evaluation of your entire visual system to see in fact you are a good candidate for the surgery. If you pass that examination and we don't find any subtle abnormalities that would preclude you from having a good outcome, then you would be considered a good candidate. So we do a number of scans in your eyes, we do an assessment of your visual health. We try to get a health history to see if your prescription is stable. More importantly, we try to establish whether or not there's any subtle eye disease that would prevent you from having a good outcome. Will I see 20/20 after LASIK is a common question that I always get with respect to patients who are interested in LASIK. Yes, you will. That's what the goal is, that's what our intended goal is, and that's what we're striving for each and every patient. And there are instances where we can get you to see better than 20/20, depending on your prescription and depending on the health of your eyes. Another question I often get is, does LASIK hurt? No, it does not hurt. We completely numb your eyes so you're completely comfortable. There is a little discomfort after the anesthetic wears off and we give you some pain medication to manage that, but that'll only last for about an hour, hour and a half, then it just goes away. Another common question I get is, how long does the correction last? And the answer to that question is for the rest of your life. One of the other questions that I get is, how do I know the procedure is safe? Well, LASIK now is approaching its 32nd year of existence. It was initially approved back in 1995. We started the studies back in 1988. So we're now approaching the 31st year that LASIK's been in existence. And so there have been numerous trials, there have been numerous studies. It's been re-reviewed by the FDA several times. And in fact, the vast majority of eye surgeons who actually do LASIK have had LASIK on themselves. So it's very safe. Another common question I get regarding LASIK is, what are the risks associated with the procedure? Well, the most significant risks are the risk of infection, which can occur postoperatively. The risks associated with performing the procedure are fairly minimal for the most part because the technology has advanced so far that really it's very difficult for us to have problems during the course of the surgery, because now it's all laser LASIK. So most of the guidance of the surgery is pretty much done by the laser itself. So there's minimal technical problems with doing the surgery. Our major concern is someone developing a complication related to infection after the surgery. Another common question is, how is a sports vision training program structured? Well, it's structured in very the same way that you would have a weight training program or any kind of sporting practice program that you have. So we do what's called a loading or a foundational phase to it. So you go through an intensive phase where we take you for the first 6 weeks, you do daily visual exercises. And then once we have that foundation, then we have maintenance training that you do during the season. We follow the same guidelines or same sort of protocol that you would use for any other exercise or training program for sports. You start out with a preseason or a foundational training, and then we have maintenance training that takes you through the season. Another common question that I get is, can sports vision training improve athletic performance? Absolutely, that's the purpose of doing it. In the same way that an athlete has to go into the weight room to lift weights, in the same way that he has to go to practice and he has to do wind sprints and all these other activities to improve his performance during playing time, same idea. We have a kind of a eye weight training program that you go in, we take you through in the same way that the athlete has to go into the weight room and train, you have to go into the visual training lab in order to do some training to improve your performance. So it's very comparable to going to the weight room training so you can get stronger. We take you to the visual training lab so we can improve your visual performance and make your visual system stronger. So another common question that I get is, do the benefits of sports vision training extend beyond the playing field? And absolutely. There have been, mostly anecdotal, but there is evidence to suggest that students or athletes who actually undergo a structured visual training program will perform better in school because it improves their ability for comprehension and reading. So certainly their ability to take in information over a shorter period of time gets improved. So there has definitely transference from the playing field to the classroom if you do sports vision training.